to come on board and be such a strong participant. We're very pleased. And I hope all of you will take heed of the QiGong, the Guolian QiGong, because it's made a big dent in cancer throughout the world. So that's all I want to say. And again, thank you.
Yes, thank you, Dr. Effie Chow. You says anything, we are listening because you are a legend. You have long time experience with this. And
I mean to say legend.
Legend. Sorry.
That means I'm old.
Sorry, you are a legend. You know everybody, you know everything. That's right. That's experience. That's really worth it. Okay, so right now we will go to the next section. Well, next speaker will be the Muhammad Yisi.
Yes, hello everyone. My name is Muhammad Isa. I would like to thank you all for giving me the chance to be in that event. I would like to say thank you for Dr. Effie Chow. I'm really honored to be in that event. And thank you, Dr. Fu. You did a lot of effort in that event. Actually, I believe that you need a long sleep after that event. I want to check, is my voice clear? Can you hear me?
Yes, very good.
Okay, that's great. My name is Muhammad Isa. I'm from Egypt. Actually, I'm a computer engineer. I studied computer engineering, and I resigned in 2013, and I continued to deep my study in the traditional medicine. My story started when I was very young. I was 15 years old. I was suffering from asthma, a very weak immune system, and I'm really grateful for the QiGong and the Chinese medicine philosophy that transformed my life. In 3 years, I just practiced QiGong, and I was totally cured from the asthma, and my immune system has changed and become more and more stronger. I would like to share my my presentation. Dr. Fu, can I share it? Okay, this one. Okay, can you see my screen now? Can you see my screen? Hello?
Yes.
Yes, I can. Okay, it's now. My presentation is the traumatic event behind the coronavirus. Okay, yes. Let's get back. My presentation is the traumatic event behind the coronavirus. My name is Muhammad Isa. I'm a computer engineer. I worked in the computing field for 12 years. 8 years I worked, in the last 8 years I worked for IBM. I resigned in 2013, and just to continue my study in the traditional medicine. I started to study the Taoist philosophy in 1994 and the QiGong, and followed that by studying Tai Chi. I traveled to Beijing in 2010 to study the Chinese medicine. I founded the Chromatic Healing. It's a healing modality that I use to cure the COVID-19. I will speak about it today in 2013. I will focus on 2 points in that presentation. The first one is the emotional trauma behind the COVID-19. And the second point is the chromatic healing as a process of healing. The traumatic event behind the coronavirus. The main theory here, what I mean here, is that our emotions and our mental perception of thoughts and feelings and behaviors are affecting our internal organs. And that's based on the Chinese medicine. The Chinese medicine stated that from several years in the 5MS theory. And it says that the hate affecting the heart, and the worry affecting the spleen, and the sadness affecting the lung, and the fear affecting the kidney, and the anger.
I'm okay. I just want to say thank you. Yeah, no problem.
Okay. And the anger affecting the liver. Our emotions affect our internal organs, and that's very clear from the theory of the Chinese medicine. The disease is actually a reflection to our state of mind, and we understand from that the disease is a reflection to our state of mind, our state of emotions. And so, from that point, understanding the symptoms and the disease will give us a deeper understanding to the state of mind that the person who suffered from that illness he was in that moment when he faced a traumatic event or a stress. I started research in the last year in March 2020 to find the core or the root cause of the COVID-19. The question was, what is the stress behind the COVID-19? What is the event that most of the people maybe pass through and that caused the COVID-19 and all the people may share that event. And I would like to share here and emphasize on a point. According to Chinese medicine, it is the stress affecting the organ and the specific organs with a specific emotions is not random. It is not just random stress. It is not just any emotions affecting any organ. No, it's very detailed. Every organ is tightly coupled with specific emotions. So, according to that, COVID-19 is affecting specific organs, so we can link that with the emotions and the behaviors and the thoughts and emotions. And I would like here to say, as from the perspective, I'm an engineer, and when I studied the Chinese medicine, I saw that what I studied from the engineering concepts, it exists in the Chinese medicine in shape of meridians, and I studied in the college in shape of circuits and electricity. It's the same concepts. And I can say that emotions affecting the organs, they are tightly coupled theory. We have here an integrated view that balancing the psyche of the person will help the body to heal fast. And sometimes if we are able to find the traumatic event that the person passed through and we heal that event, maybe the person doesn't need any other intervention, just by balancing the emotions and the thoughts and meditating on that event and balancing that event, the curing of that disease will start naturally. The methodology. Actually, I used the cognitive coaching. It was just one-to-one sessions where more than 35 persons. I introduced them personally with my own self, and I helped them to reach the healing with a chromatic healing. And the usage of the cognitive coaching is to know and find what is the emotions and the stress common between all the people that participated in that research. All of them have a common similarity on the mental emotion stress. All of them, they pass through a traumatic event which share on the abstract level that event, and I'll give that. I will say more details about that. And I need to say what I will share. It has to be traumatic. Maybe people pass through that, but if it is not traumatic, it will not affect them. It will not affect their energy and immune system. It has to be traumatic event affecting them very deep. The result of my research was there's a separation event that they all pass through. All of them has passed through a separation event. And a separation event, I mean by separation event that it can be separation from a loved one, separation from a wife, separation from one of the family members, separation from a husband, from separation from a son, daughter, any kind of separation. And one of the interesting part also, I found someone had been infected by COVID-19. She had been separated from the home she loved. So any kind of separation from subject that I belong to, or there is a kind of energetic connection. After that separation, the person starts to feel there is a huge loss. I lost that person, I lost that thing. And then they go in a deep sadness, and the sadness affects the lungs. And as I mentioned, the sadness affects the lungs. And that event starts to affect their self-esteem, their what they believe about themselves and what they believe about their life. All the people that I have interviewed, they have passed through the same feeling and the same patterns, mental patterns in different scenarios. Some of them separated from husband, some of them separated from fiance, from a land, a homeland, from a job, whatever is a separation event, and the details is. On the abstract level, they share that problem. And I would like here to look for the COVID-19 from the perspective of organs and to go deep more in that. The internal organs that they are mainly involved in the COVID-19 research is the lungs, the heart, the kidneys, and I would like to include also the blood. I will consider it an organ also. It is not written here, but I'll speak about it also. The lungs. We need to understand that the lungs is a metal element, and the separation event is a metal element also, because the metal is separating, have the ability to separate between two things. So the sword separate between two things, the knife separate between two things. So any separation is a metal element event. So when it goes wrong in a separation event and affects the person negatively, it's affect the lungs. So it go deep to the lungs. And after that separation event, they feel that there is sadness. It's the same. It's go deep to the lungs again, because sadness is a metal element. And also, as I mentioned, they started to believe they lost the value of themselves, because losing the husband is losing a value. And that a value is the same as a metal element, which affects the lungs again. And that makes explain how the COVID is affecting the lungs deeply and very strongly. The other point, the other organ here is the kidney. And the kidney, according to the Chinese medicine, is linked to life. Our life and what we believe about life, and life and death is beliefs and emotions is affecting the kidney. So when the people pass through such event, they lose someone, they lose a value, someone they believe that they're very valuable for them, they start to believe that I lost the interest in life. My life will not be again as before. I remember one of the people that I work with, and I helped them through the COVID-19. He lost his father, and he said, my life will not come back again as before. I lost the taste of life. My life will not, I'm just living because I have to live. And that's affect the kidney, and that's explain why the kidney is affected in the COVID-19. It's a loss of valuable thing because of separation, and that affected my life and my belief about life. And by the way, I would like to say that here I refer here, the event is a life-turning event. What caused the COVID-19 is a life-turning event, which the same goes to the kidney, and that's from the understanding of the people that I had interviewed. Again, the last the last main organ I will mention here is a heart. And the heart, not all the people, they get heart attack in the COVID-19 infection. And that's because the heart, according to Chinese medicine, they believe that the heart is the king and the body is a kingdom. And the heart, it controls the body. So the heart is the king of the whole body, which is the kingdom. And the king get worried or feel irritated if someone is trying to attack his territory, his kingdom. And the same in the COVID-19. If the person, because he's lost for his beloved one, and he felt that he's losing the value of life, he felt that his territory is being attacked, or there is a conflict on the level of territory. For example, someone is losing his wife. The husband considered the wife in his mind that she is his own territory, and she asked for divorce, and she ran away. He felt after that he lost his territory. That scenario or pattern is enough to cause a heart attack, plus to the COVID-19 symptoms, because that event affects the heart deeply. And so the traumatic event of the COVID-19 is separation event that causes the feeling of loss of value. And the person starts to believe and disbelieve in himself. I'm not able to live in life again. Life will not be like before again. It's a turning point for me. And at the end is a deep grief. Actually, all the sessions that I have did for the COVID-19 infected people, I work with them only for 8 days. I did the first session, and after the first session, and when I applied this, my theory, after the first session, some of them suffered from the COVID-19 for 1 month and more, and some of them was very severe cases. The interesting thing is that after they did the session and balancing the emotion and finding that event, and they feel balanced emotionally and mentally about that event, the next day after 24 hours, I can say that the symptoms of the COVID reduced by 50%, and this was very fast. And I felt amazed by that, and the symptom was fever, and fatigue, and pain, and headache. Some of them cannot walk. Some of them have a severe headache, and the temperature is always a high temperature. It doesn't go down. So after doing the first session, there's a noticed change in the symptoms by 50% by all the people have participated in that research. And then I repeat the session after 3 days. On the third day, I do that session, the second session, and I follow up, and I make sure that their emotion and their understanding to the disease, and I make them accept the disease. It is not a problem. It is just a feedback from the body to the event that you pass through. And here the anxiety levels start to drop and drop and drop. And by the second session, on the fifth day, the symptoms get reduced by 90%. And that's by the fifth day. On the 8th day, almost in a week, all the people have participated in that research. All of them totally, I can say, the symptom disappear. The symptom disappear totally on the 8th day, and they start to feel that the energy is getting back again. They can walk again. And the interesting point here is that after the second session, they start to get back the sense of smell and taste. The idea here, what I'd like to say here, if we are able to deal with the separation event that the people has passed through, and balancing emotion and what they believe about that, and what they believe about themselves, and what they believe about the life, the healing and the symptoms will be disappeared in 8 days. That's according to what I studied and researched with the people that I have worked on, and also balancing the mental emotional part will help a lot in healing the COVID-19. The total of number of sessions I did was 2 sessions only. I did just only 2 sessions without any kind of interventions, and some of them, by the way, they weren't taking any medicine. They were just taking just Panadol or painkiller because of the pain that they are suffering from in the knees or in the joints in the body. I used actually the Chromatic Healing, and it's a healing modality I have developed in 2013, and this is based actually on the Chinese medicine and the ancient Egyptian medicine also. And I made use of my study to the to engineering concepts as a computer engineer, and I mixed all of them, and I made the Chromatic Healing. It is based on the scientific approach of the Chinese medicine and the ancient Egyptian medicine and engineering concepts. I used the concept of systems, the systematic. I started to look at the body from the view of systems, and here we will look here in the Chromatic Healing. We believe that the body have an aura or a biofield. In the Chinese, they call the Wei Qi, or the defense Qi. It's our defensive system around the body. It's part of our immune system. The Chromatic Healing sees that if there is a negative event that we pass through, as we see here in the slide, there is a kind of a negative energy start to appear in the biofield, and the existence of this negative energy will let the disease or the illness go through and attack the body. The Chromatic Healing sees that the imbalance of the body is an imbalance of energy, as we see the negative energy, an imbalance of colors. When I say colors, I mean vibration, I mean frequency. So, for example, when someone get attacked by negative energy, they find that this negative energy may cause a red energy, which we see it in the Chromatic Healing as kind of heat or high blood pressure or inflammation. So the role of Chromatic Healing is balancing the color, the frequency, and the energy. So after we do the session, the body get balanced, the colors get back again, and because in the Chromatic Healing we believe, as the same as the Chinese medicine and also in the ancient Indian traditions, that the energy centers have colors and the organs have colors, and they need to stay in that frequency. And that's the normal, that's shape of the normal human being. This color has to be homogeneous, has to be in balance. They look beautiful, and that's after we do the session. The body has to be with that look or with that frequency. I'd like to share with you here. I don't know if you can hear. Wait. I would like to wait. Okay, I will share it again. Sorry. Okay. Okay. Where? It's the. Sorry. I don't know if you can hear. Okay, sorry. You to go back again to that part. I would like to share to hear that Dr. Rania, she is from England, and she is one of the people that I applied on the Chromatic Healing on, and I founded the trauma, and I would like to listen to her.
Hello, my name is Rani Al-Khatib. I am one of emergency physician in UK. I'm working with NHS Foundation Trust. On 7th of March, I got COVID. I'm working directly with the COVID patients, so I got the infection from the hospital. The symptoms started as a sore throat, little bit of vomiting and diarrhea. Then after 1 week, I start to have some cough, shortness of breathing, severe joint pain, dehydration, fainting, dizziness. I was on healing process, and on 29th of March, I did a coaching session with the Master Muhammad عيسى. It was about recognizing what was the root cause of COVID. So we have 2 sessions together. Within the first session, almost 50% of the joint pain and body aches subsided, and after the second session, almost 90% of the joint pain subsided. I would like to thank Master Muhammad عيسى because he recognized the root cause of the COVID-19 in most of the patient, and hope all patients will get benefit from all this important information. And thank you.
Thank you, Dr. Rania. And I would like to share at the end and say the world will be a better place by being together. And I'm really thankful for this opportunity to share with you my research. And this is I'm at the end of my presentation. Actually, the head office of our Chromatic Healing is in Egypt, and I teach that in several countries in the Middle East. And soon we are planning in 2022 we'll be at the US starting to teach there. And thank you very much. My contact email and website. If you need anything, you think that I'll be helpful in anything that you need or on your team, I would like to join, and thank you very much.
Thank you very much, Muhammad. Hope we keep contact. And
yes.
I use the email. Yes. The Tony, I saw the Master Tony here listening very serious. It's good. Okay. So we're beginning with the next section. I will first introduce the host.